We've talked in the past about content of the records and time limits and retention schedules, and where we get those regulations and rules and standards and codes or laws that tell us what has to be on a record and how long they have to be kept and how they have to be kept. So in this presentation, I want to take you to the websites of the Code of Federal Regulations, which houses the conditions of participation. We've talked about those before. I'm going to take you to the Alabama Department of Public Health website so that you can look at the rules for hospitals and also other health care facilities. Remember, hospital has to have a license in order to operate, and in order to have a license, they have to go through a survey and show that they are meeting certain rules and standards, and in the state of Alabama, that would be through the Alabama Department of Public Health. That's the licensure agency for the state of Alabama. Also, we're going to look at the actual Code of Alabama, just as we're looking at the Code of Federal Regulations, so the federal written laws. We're going to look at the written laws in Alabama and look at information regarding consents and who can consent and the ages and where we get this information. Although I'm not going to go over the Joint Commission standards, that was another place that we can determine what has to be on a record if we're Joint Commission accredited. Remember, that's a voluntary thing, but that if we are accredited through Joint Commission, we have to meet the Joint Commission standards. We'll say that in regard to health information, Joint Commission standards, and the conditions of participation pretty much go hand in hand. But I wanted to show you places where you can go and look up the specific standards or laws, the conditions of participation, the state laws, the licensure laws, those types of things. On the screen, I have the electronic Code of Federal Regulations. So there, and you'll notice there's a note up here that said that site, that the URL had changed and that it is now ecfr.gov. You used to have to go to the main page for just the Code of Federal Regulations in order to access the electronic code. And so we can get these online, but also, of course, there's the hard copy, and I've talked about the Title 42 of the Code of Federal Regulations, which has the conditions of participation in anything to do with health care. And so we can most certainly have a paper volume to look at, but we can access the Code of Federal Regulations online now. And so we're at the site, and if you have to use this for your assignment on a test, I will give you the site. I will give you the address. And as we come to this page, you'll notice that you can browse by selecting a title. And remember, a title is just like a different section. They're different titles of the Code of Federal Regulations that have to do with different topics. Title 42 has to deal with health care. And so there's a drop-down menu, and you'll see all the different things in the Code of Federal Regulations. There's regulations about the Postal Service, about pensions, about navigation and navigable waters, about the national defense, the Treasury, those types of things. But Title 42 of the Code of Federal Regulations deals with healthcare issues, and that within Title 42 we can view the conditions of participation. So we'll click and go, and then we have another decision to make. Title 42 is divided into different volumes, and you'll see what the different volumes cover, like Public Health Service, Department of Health and Human Services, Centers for Medicare and Medicaid Services, which would be the category that we really need to look at. And just so you'll know that 482, and it's actually .24 of Title 42 of the federal regulations, or the Code of Federal Regulations, contains the conditions of participation. So we're going to click there, and so you'll notice here's a listing. Here's conditions of participation for hospitals, and that's what we're going to look at today. But you'll also see here's some requirements for states and long-term care facilities, such as nursing homes, home health care services, conditions of participation for specialized providers. So there's all different codes or laws in regard to different areas of health care, laboratory requirements, those types of things. But we're going to look right here at the conditions of participation for hospitals. And we're taken to a page, and you'll see the different subparts. A are the general, subpart A contains the general provisions. Subpart B, administrative issues. And then subpart C, basic hospital functions. And you'll see that under that there are different, what we would probably consider different departments in the hospital. There's conditions of participation that have to be met by different hospital departments, but they're calling them functions. And so here's one for quality assessment, medical staff, nursing service, and look at the fourth one on the list, medical record services. There's things about the physical environment of the hospital. There are different conditions that the hospital has to meet. But we're going to look specifically at medical record services, which is 482.24. And as we look at this, you'll see it's listed. 482.24 are the conditions of participation, medical record services specifically. And we can go down and say, okay, what does CMS say that we have to do or have in regard to medical record services if we are a Medicare certified hospital? And remember, if you accept patients and get paid for treating Medicare patients, you have to be certified and meet these conditions of participation. And so as we look at these, by no means do you go down and memorize all of this, but for example, the hospital must have a medical record service. That's the first thing that the conditions of participation say. We have to have, it has to be staffed appropriately. It talks about retention of records, and up under that, this is where it says medical records must be retained in their original or legally reproduced form for a period of at least 5 years. So we know that in order to meet the conditions of participation, we have to maintain or retain records for at least 5 years. We have talked, and we will talk about instances where we'll keep them longer. And if the state says we have to keep them longer, then we will keep them longer. But at a minimum, we have to keep medical records for at least 5 years according to the conditions of participation. Then as it goes down, it talks about the content of the record. What does the medical record have to contain? Information to justify the admission and continued hospitalization of the patient, has to support the diagnosis, describe the patient's progress in response to any services or medications. You have to be able to read it, has to be legible, has to be complete, has to be dated and timed, and all entries authenticated in writing or by electronic form. It talks about orders, and that they have to be authenticated, and that there can be pre-printed or standing orders used. As we go down, all records must document the following as appropriate. There has to be evidence in the medical record that there is a medical history and physical has been completed on the patient, and the documentation has to be no more than 30 days before or 24 hours after admission. And we've learned that before, that a H&P has to be on every inpatient hospitalization, has to be on that patient's record within 24 hours of that patient being admitted to the hospital. But we also learned, and I hope that all of you remember this, Notice it says here, but prior to surgery or a procedure requiring anesthesia services. And what that's saying is that it has to be on there within 24 hours. And it has to be in there on the record before surgery. So if you think about it this way, if a patient comes in the hospital and goes to surgery within an hour or two, which can happen if they're admitted on the same day that they're having surgery, that H&P has to be on that chart by the time the patient goes to surgery. And so it has to be the lesser of these two times. And so if a patient goes to surgery without an H&P on that record, that is a violation of the conditions of participation. And so we've talked about that in the past, but this is where we get those requirements. Also, Joint Commission says basically the same thing in its standards, that there has to be an H&P on the record within 24 hours. Also, it talks about there has to be an admitting diagnosis on the chart. We usually find that we can find it on the H&P, but it's usually the admitting diagnosis is on the face sheet. There has to be results of basically everything, of consultations, and also findings from clinical staff. There has to be documentation if there are any complications, or if the patient has a hospital-acquired infection or any type of reaction to a drug or to anesthesia. That has to be on the chart. It talks about there has to be proof of informed consent on the chart. And then there have to be orders, there have to be nursing notes, there have to be medication records and radiology and lab reports, and the vital signs have to be on the patient. And then it says there has to be a discharge summary, and that discharge summary has to include the outcome of that hospitalization, disposition, so where the patient go when they were discharged from the hospital, when he or she was discharged from the hospital, and also what about follow-up? That needs to be listed on the discharge summary. So all types of things. Also says finally that the record has to be complete within 30 days of discharge. And so these are the conditions of participation just for medical record services. So if you need to look them up, you go to the Code of Federal Regulations, either to the actual hardback or hardbound books, and you can look up the same information, but now we can look it up online. We've also mentioned that in order to even open its doors, a hospital has to be licensed. And licensing is a state function. So in the state of Alabama, the Alabama Department of Public Health is the entity that licenses facilities. And so I'm going to take you to the Alabama Department of Public Health's website. And again, I will give you these addresses. Now, this website, I'll just tell you right off the bat, it changes its look very often. You know, the major structure's the same, but there might be news on flu vaccines one day, and then the next day there's something else as the major part of the home page. But you can come here and find the licensure requirements for all different types of healthcare facilities within the state. And the way you do that is you'll see on the left-hand side of the page there's a link to many things, but healthcare facilities. And so if we go and follow that link, then in the middle of the page you'll see more links, and it talks about the surveys of healthcare facilities in order for the facility to be licensed. And then it lists a directory of the healthcare facilities that are licensed in the state, and basically defines facilities, what's a hospice versus a hospital versus a assisted living facility, those types of things. But in the middle, it says healthcare facilities rules, and that's what we need to look at, because if we're a hospital, and I'll also show you where you can go if you worked for hospice or you worked for a dialysis center or something, where you could find the actual rules for licensure. And so I'm going to follow the healthcare facilities rules link, and here's a list of the different types of facilities that can be licensed. Here's a sleep disorder clinic, rehab facility, nursing homes, those types of things. And in the middle of the list, here's hospitals. and actually it is going to open up a PDF form or PDF file that has the rules. Now, as we see, the PDF file is specific for hospitals on this one. Of course, there are others. And there is a table of contents, and look at all the things there are rules about emergency services and pharmaceutical services, surgical, anesthesia, infection control, quality assurance, medical staff. But the one that we're going to focus in on is medical record services again. And some states may call it health information services. We've pretty much gotten away from the medical record services, more health information. But this tells me that it's on page 28 of this particular document. And again, can have this in pencil paper, in printed format. And if we'll go down to, what page is this? 26, 27, 28. Here we start with medical record services. So 420-5-7- dot 13 is the section where you find medical record rules for hospitals from the Alabama Department of Public Health. And they look pretty familiar because they kind of look like the conditions of participation, but some things are a little bit different because the conditions of participation will actually say things such as, for example, with verbal orders, they have to be signed following state law in regard to time limit and things like that. So this is the state law that they're talking about. And so notice it says the hospital shall have a medical record service that has administrative responsibility for medical records, and that a medical record shall be maintained for every individual evaluated or treated in the hospital, where the condition of participation said both inpatient and outpatient. But this is basically saying the same thing here with form and retention of records. The hospital shall maintain a medical record for each inpatient and outpatient. So they get more specific right here. It said medical records shall be accurately written, promptly completed, properly filed, and retained and accessible. No good having a record if you can't put your hands on it or you can't get the information. Then they talk about medical records shall be retained in their original or legally reproduced form for a period of at least 5 years. That's the same thing that the conditions of participation said. But, and this is a recent change, now the state or the Alabama Department of Public Health says, in the case of a minor patient, records shall be retained for at least 5 years after the patient has reached the age of majority. That used to not be the case. That they didn't go and say that, okay, you have to keep it for 5 years and then 5 years past, if it's a minor, 5 years past the age of majority or when that individual becomes an adult. So that's not a fixed number. That would be different for a newborn versus a 17-year-old that came into the hospital. The hospital shall have a procedure for ensuring confidentiality of patient information, and it should not be, no copy should be given or released unless it's to authorized individuals. It goes down, and all orders, including verbal orders, shall be dated, timed, authenticated. But then they go into more specification here. It says they have to be authenticated within 48 hours. Now, the COP didn't say that. The conditions of participation said that they had to be authenticated, and then it had to be by state law. And sometimes there's not a state law, so they don't give a time limit, so they would go by the policies of the particular hospital. But the state of Alabama says verbal orders have to be authenticated within 48 hours. Then it goes through about what has to be on the record. And like I said, all of this sounds very familiar because a lot of it's verbatim, the conditions of participation and the licensure laws by the Alabama Department of Public Health. And so, again, final diagnosis with completion of medical record within 30 days. And also it adds another, the hospital shall maintain a plan to transfer all records to another facility in the event the hospital ceases operation. And so this is where the particular rules are in regard to licensure. And so we would have to go by these because, of course, if we work in a hospital or any other healthcare facility, I don't say any other healthcare facility. In some facilities, like a doctor's office, it's not the office that's licensed, it's the individuals who provide care have licenses. But hospitals have to have a license in order to operate. Okay, one other site we're going to go to that I want to show you is the State of Alabama legislature site, which has the Code of Alabama. So the written laws, the statutes, just like there was the Code of Federal Regulations, that was on the federal level. But Alabama has the Code of Alabama. And in order to access it, there is a site, it's called Allison. And that stands for Alabama Legislative Information System Online. So Allison is where you go to look up specific laws in regard to the state of Alabama. Now, just to get it in your mind, we talked about the rules from the Alabama Department of Public Health. Those are licensure rules or laws that we have to follow. But then there are other laws that are on the books in regard to health care, or mainly consent and different things that have to be done, and those are in the Code of Alabama. And so at Allison is where we can go look these up. And when you come to look at a law or view one, you'll also see a tab over here on the side off the home page that says Code of Alabama. So if you click on that, you'll notice right here, if you weren't looking, you might not see that showed up. It says search or view. So we can search, put in particular information into basically a search engine, but we're going to, in this instance, view the codes. And so all of the laws in the state of Alabama are listed. And just like we had, for example, Title 42 of the Code of Federal Regulations that dealt with health care, there's a particular title in the Alabama laws that deals with health care. These will be listed by titles, and you'll see aviation, animals, commercial codes, businesses and nonprofit entities, courts, criminal codes, education, elections. It just so happens that Title 22 of the Alabama Code deals with health, mental health, and environmental control. So if we go to Title 22, we'll be given two selections: health and environmental control, and then mental health is a different category. So if we look in this particular section, we'll see the different chapters, and sometimes you will know the actual Alabama law, the number, and you can go straight to it to actually read it verbatim. But other times you may have to say, okay, well, what am I actually looking for? If you go down, we're in Title 22, and if we go down to Chapter 8, that deals a lot with consent for health services, and something that we deal with because the proof of the consent is on the medical record or the health record. And so in the state of Alabama, we need to know, okay, when can an individual consent for treatment? So as we go down, we see Chapter 8 has consent for health services. If you look down, when consent of missing husband or wife is not required, when minor may give consent generally, consent for minor for self and child if a minor has a child. Let me see. Consent of minor for donation of bone marrow. So let's look at this. When a minor may give consent generally. In the state of Alabama, according to the Code of Alabama, Section 22-8-4, any minor who is 14 years of age or older, or has graduated from high school, or is married, or having been married is now divorced, or is pregnant, may give effective consent to any legally authorized medical, dental, health, or mental health services for himself or herself, and the consent of no other person shall be necessary. So that's the law in Alabama, that once you're 14 years old, even though you're not an adult, then you can give consent. A minor who is 14 years old or older can give consent for any medical treatment. Now I wanted to show you, that's what we looked at, when a minor may give consent generally. Now let's look, it says, here's another section on consent of any minor as to pregnancy, VD, drug dependency, alcohol toxicity, and reportable diseases. A separate law says any minor may give effective consent for any legally authorized medical, health, or mental health services to determine the presence or to treat a pregnancy, venereal disease, drug dependency, alcohol toxicity, or any reportable disease, and the consent of no other shall be deemed necessary. Now this is saying something different, that a minor of any age that is pregnant or has a venereal disease or needs treatment for drug dependency or alcohol toxicity or has any of the communicable diseases that are reportable by state law, any of these, that individual, no matter how young they are, the 14 years old, that doesn't matter, anyone that meets any of these conditions can give consent. Also, it's going to look at, for example, vital statistics. We talked about this in HIT 151 and the different information that we have to gather. It's usually gathered in the Health Information Department. In regard to birth certificates, we usually begin the death certificate and the fetal death certificates, and we get those signed and we collect the fees and send the information to Montgomery. And so here is the actual law that says we have to do this. So it says who has to do what. And so if we look down and we had any questions regarding, here's death registration, here's new birth certificate upon adoption, here's registration of births. So we can look at the law concerning birth certificates, basically that part of the vital statistics laws. And it will say that a certificate of birth for each live birth which occurs in the state shall be filed with the Office of Vital Statistics. When a birth occurs in a hospital or en route to the hospital or institution, the person in charge of the institution or his or her designee shall obtain the personal data, prepare the certificate, secure the signatures required, and file the certificate as directed in subsection A. And the physician or other person in attendance shall provide the medical information required and has to be certified within 72 hours, but then it will have actually the time limit for when it has to be actually submitted. Also tells about other information that has to be gathered. It goes very specifically into, in the state of Alabama, it says for the purposes of birth registration, the mother is deemed to be the woman who gives birth to the child. If the mother was married at the time of either conception or birth, or between conception and birth, that the husband will be named as the father on the birth certificate, unless, and that we talked about if someone else is taking responsibility for paternity. But this says that if the mother was not married at the time of conception or birth, then the name of the father shall not be entered on the certificate. And so you don't just name anybody as the father. Even though that happens on TV, you see that happening. We have to have that affidavit of paternity in order for an unmarried woman who gives birth to have a father listed on the birth certificate. But normally, and that wasn't always the case, it was just if you're married, your husband's the father. If you're not married when you have a child, then there is no name for father put on the birth certificate. And that was the law, but it changed quite a while back. So information on that, as well as information on death certificates. Here's the reportable diseases. I'm giving you a list of those before that have to be reported to the health department, and those are listed here. So there's all types of information listed in regard to the code of Alabama, the written laws, the statutes, to tell us many things we have to do in regard to health information or just health services in general. So those are the three basic sites that I wanted to show you, and that we can go and actually look at the specific laws. And again, if you were asked on whether it's an assignment or a test, I would not ever ask you to memorize the actual number, or section of a code, but you should be able to write it down and know what that is, that identifies a particular law. And if it was the Code of Alabama, Section 22, which we know deals with health care, and it's 22-8-4, that's the law that states when a minor may give consent to treatment, and the law will be written out. But Section 22-8-4 just is basically think of it as the title of that law. So that is the particular code. So we've looked at Allison, which is the legislative site in the state of Alabama, where we find the Code of Alabama. We've looked at the CFR, or the ECFR, the Electronic Code of Federal Regulations, and inside Title 42 of the Federal Regulations is we can find the conditions of participation. And also we have the hospital rules, or the rules from the Alabama Department of Public Health. Now, as we went to that site and looked, I wanted to show you that in addition, and we're back at the Alabama Department of Public Health here, that I wanted to show you briefly that we went into hospitals. But say, for example, that you don't work at a hospital, you work at an ambulatory surgery center. And remember, we looked and it said that you had to retain records for 5 years, plus with minors 5 years past the age of majority, or when someone becomes an adult. Then let's say, okay, well, I don't work in a hospital. You can't assume that the retention rules are the same, or anything is the same as far as content of record. So let's just look. We could look for hospice or home health or nursing homes, but let's look at ambulatory surgery. And just as we did before, we can look at the actual rules, and these are for ambulatory surgery centers. And the table of contents is not as narrowed down in this particular one, but let's say that we want to find out about medical records in an ambulatory surgery center. And you would have to, go down through there and look. They're talking about the chief executive officer, the personnel in the ambulatory surgery center, fire evacuation plan that has to be on records and reports. So we're narrowing down here. And notice it says medical records are to be kept. An ambulatory surgery center shall keep adequate records, including admission and discharge notes, history, physical examination, nurses' notes, etc. Then notice it says that all records shall be written, dated, and signed in an indelible manner, meaning it can't be erased or eradicated, and made part of the patient's permanent record. It says that records have to be filed. And, a lot of this wording will change eventually because we don't file records if they're like electronic records. But storage, they have to be stored and protected against fire and water damage. Who owns the records? Property of the physical property of the particular facility. It says that records have to be confidential. And look at preservation here. Medical records shall be preserved either in the original or by microfilm for a period of not less than 6 years following the most recent discharge of the patient. In the case of a minor, records shall be kept for 6 years following the patient's obtaining legal age. So we went from 5 years from hospital records to 6 years for ambulatory surgery records. They also are very specific about how records have to be disposed of, and talks about vital statistics again. And so different types of facilities will have different rules for licensure in the state. So again, we looked at the conditions of federal regulations, or the Code of Federal Regulations with the conditions of participation. We looked at the Alabama Department of Public Health licensure rules, and then we looked at the Alabama Legislature's online site that gives us the actual Code of Alabama, the written laws in the state of Alabama.